Afternoon, I'm Eric Deaton, running for the U.S. Senate in Ohio. I'm here today to talk to you about health care. It's been a pretty big news story lately. We've all heard about it. We all have our opinions. We all realize there's problems. A lot of us don't think that the problems were addressed, and we're not too happy with what our federal government gave us. In a nutshell, health care is best provided when you, the patient, and the doctor are real close together. When you're right there beside each other, you're going to get better service at the best cost and the most reliability. And we have insurance companies, and they space us apart. Sort of a necessary evil in this day and age with so many different procedures and so many different things available, different hospitals and networks around the country. But when you put government in the middle, as we already have with Medicaid and Medicare, that spread of the insurance companies becomes so big I probably can't get my arms far enough apart. You guys understand? It doesn't make things more efficient. It doesn't make care better. It doesn't make it any cheaper. What our government needs to do is to eliminate all the regulations, allow insurance to be sold across state lines, regional borders, city lines, open up the full field of the American spirit. Let the American way of competition, capitalism, efficiency, inventing the better mousetrap, performing things better, either through management systems, procedures, or with new equipment. If you let the American spirit address this issue, we will lower the cost of health care, increase the quality, and get more people covered. I envision a system with a government that's so determined to implement health care and to help make a change in America. I think the government should have said that on January 1, 2012, that all federal workers, many millions of them, had 6 months enrollment period, and tell them with deregulated insurance business, you guys need to go find yourself an insurance company, and the moment you do, you'll come back to us and fill out a piece of paper, and all your benefit money for health insurance will be turned into salary. And now you're on your own forevermore. No more government insurance plan. It's just you and your paycheck, talking to your agents, and picking the insurance you want. By doing so, we would have put millions of people into this private insurance field. And the big companies would have soon followed, doing the same thing, taking that benefit off the table, paying their employees the money that they were paying anyway, and giving employees true choice once and for all in their lives. In that way, each one of us could go buy that insurance, just as we buy our auto insurance, our life insurance, insurance for our dog, cat, our boat, our home, disabilities, umbrella policies, liabilities, all these insurance products we can go buy from an agent. But health insurance has always been some little special niche with less competition, big groups, hard to get into. If we deregulated that and we let the American spirit unleash itself in this healthcare environment, we could drive the cost down, make hospitals more competitive, make the insurance companies more competitive, and get more people covered. That makes the system now portable. And if you lose your job, you're now buying your insurance directly, so you didn't lose your insurance. Sure, economic times will be tough for you having lost work, but you could go talk to your agent directly. Say, Bob, what can I do about my insurance costs? I'm on unemployment right now. I need to cut down the bill. Well, let's see. We can put your car on liability only and drop that collision. That'll save you $100 a month. We're going to take your insurance plan and you run that gold level plan that you picked out. We can put you down here in the bronze plan. You seem to be pretty healthy. And we'll leave you there till you get your job back. And you can come back and see us and we'll get you fixed. And this way, people can buy the insurance that fits themselves, fits their families. If you need a basic level entry plan that's going to cover the catastrophic problems you may see, big injuries, unexpected stuff, then get that bronze plan. But as far as day-to-day stuff, you're going to pay it out of your pocket. If you visit the doctor because you got a cold or you buy a prescription here or there, pay it out of your own pocket. You're not paying insurance premium there as much, so you would be able to afford to do that. How about the silver level plan? You got a decent job, you know, you got a few kids, maybe you want the silver plan. How about the gold plan or the platinum plan? It's just a concept I have. But I imagine insurance companies will offer many tiers of insurance products. Maybe Bill Gates don't want to have to worry about, you know, where he goes to the hospital, who treats him, paying some out of the pocket, some not. Maybe he just buys this platinum plan knowing he has that card and he can use that card at any hospital, any clinic. They're going to cover everything, 100%. It's probably going to be a pretty expensive insurance product to buy, but he can afford it. A guy like me, maybe I'm in there in that silver, maybe gold plan, just depends on where I want to put my money, how risk averse I am. But at least there'll be offerings, and people can buy that catastrophic plan that they need if they don't have the money to pay for it anymore. It still gives it to competition. It'll force companies to start performing more efficiently. Even the hospitals could improve their pricing so that they appeal to insurance companies more. It's a necessary evil that we have to address healthcare. By having government mandated healthcare, penalties for not purchasing it, and still a lack of competition, and this inevitable push to get us on a single payer government plan is just not right. It's not constitutional. It's not competitive. It's not the American way or within the American spirit. I want to see a medical system where we continue to develop new technologies, better test equipment, better drugs, new procedures, techniques to improve our health. It costs money to do that. Research and development is expensive. We need to foster that through those people that are willing to pay that, some of that extra money. The guy that buys the first big screen TV pays a lot more than the guy that buys it 3 years later. And the guy that buys that platinum level plan, well, he's probably going to be helping push some of that new technology. But it'll trickle down to all of us, improve all of our lives. And as we export that technology to the world, it'll give us jobs, meaningful products that we're selling in the global economy, help push our economy along. Healthcare is important. We do need to deal with it. I understand there's problems with pre-existing conditions and people that are unable to provide for themselves with deformities and mental problems. I know we have to deal with all these items individually, but the very framework of our system should be based on private enterprise, the entrepreneurial spirit, competition, and efficiency, the things that made America great and made us grow. Please check out my healthcare paper in full at www.deatonpercent.com under the positions page. Thank you for your time.